Hello, and welcome to Everyday Creation, the show about living our purpose, lifting our vibes, and expressing our creativity for the highest good. This is Kate Jones with the first of four excerpts from a longer interview with family medicine physician Adeola Fakolade, MD. In this short episode, Adeola traces her path from Nigeria to the US.
And my journey to Ashtabula has been Nigeria through Pittsburgh, Cleveland, and then Ashtabula. So it wasn't straight to Ashtabula. But while I was in medical school in Nigeria, I knew that I wanted to come to the US for training because the United States healthcare system is one of the more advanced like healthcare systems in the world. Now, granted, it's not perfect, but it's pretty good. And the training opportunities here are probably one of the best, if not the best in the world. There's a lot of research going on, et cetera, and all of that. So when I was going through medical school and graduating, I already knew that I wanted to do that because I wanted to just to be able to be the best doctor that I could be. So I knew that I wanted to come for my specialty training in the United States. And so I graduated from medical school in 2011. And so in Nigeria, when you graduate, you have to go through like a 1 year mandatory service to the government. So it was during that time that I decided to sort of start taking the steps to move from Nigeria to here. And those steps entailed taking the board exam. So the same board exams that medical students would take here in the United States, I had to take them. And so it was like United States medical licensing examinations. There's a total of three exams. There's a step one, there's step two clinical knowledge, and there's step two clinical skills. And then there's a third step, step three, but you don't really need that to get into residency here. So during that year, I just kind of sat and studied and took basically all the three exams that I needed to come here. It took me about like a year and a half of studying. Especially my life then was go to work, come home, study, bed, wake up, go to work, and just rinse and repeat all over and over again. But it paid off, thankfully, because I'm here now. And so I did that. And then eventually I had to come here to do like a clinical rotation. I had to come for interviews. And thankfully I matched. So I matched into a family medicine residency program in Pittsburgh. It was the University of Pittsburgh Medical Center in McKeesport. It's an absolutely, absolutely wonderful program. It is very international medical graduate friendly, number one, but it is also it serves like an urban underserved population in the US. There's a lot of need where the clinic is and a hospital where the residency is based. And so you get to serve a population that really needs that help. And in my program as well, there were different tracks. So if you wanted to get more training in like a specific track, we have like the HIV track, we had the global health track, we had obesity. I think now we have obesity medicine after I graduated. And then there was also a wound care track. So I also got into the global health track. And so part of that was also kind of traveling abroad to go do some medical rotations abroad. So I went to Ghana, I went to Honduras. I was able to start like a project as well in Ghana that I kept going for about 2 years. So I had a lot of wonderful, wonderful experiences in residency. And so I think it was towards the end of my second year. So the family medicine residency training in the United States is 3 years. And so it was towards the end of my second year that I started sort of getting a little dissatisfied, if you would, with just the status quo. It almost felt like I was seeing the patients over and over again for like the same things. Like, okay, you're here, your blood pressure is, is high, but just your medications, etc. And it just felt like I could be doing more to maybe potentially even prevent the patient from showing up in my office in the first place, or at least showing up in my office with a problem. You know, maybe just helping them like leave better or leave healthier, so to speak, and take more of like a preventive focus than more like treatment based. And so I decided I did some research and then I found like preventive medicine, like general preventive medicine and public health. And so I started applying for fellowships in that and I did match. And so I matched that Case Western Reserve here in Cleveland. And so that's the Cleveland part of my journey. And so I did my fellowship for 2 years. Part of that, you have to get like a master's in public health. And then we do different rotations in public health, essentially. So we do healthcare management, we do healthcare policy, we do core public health, like with the Board of Health. There are also multiple like elective rotations that you can do. I did a rotation actually in DC with the United States Preventive Medicine Task Force. So that's the body that kind of makes screening recommendations for the United States population, saying like, maybe your doctor has told you you need a colonoscopy. They are the ones that sort of set those guidelines, so to speak. And they do that. It's very research based, very evidence based from data from the US, data from Europe, all over the place. So I did that as well. And then in my last year of the fellowship, which was 2019 to 2020, we had this thing that happened to the world, the pandemic. So if there ever was a time to be doing a public health fellowship, that was the time to be doing it. It was very busy. It was a lot of hard work, but I am so grateful that I got the opportunity to train during that time. And I got a lot of on the job training, like just bread and butter public health. And it was really, really fulfilling work. It was really, really rewarding work just for me personally. I did a lot of work with the nursing homes because the nursing homes were hit pretty hard. During the pandemic. And that's also a vulnerable population, people that are in nursing homes. They're at higher risk where there's a pandemic or there's an outbreak, etc., and all of that. So once I graduated from my fellowship, then I completed like my waiver at Ashtabula. It's just an hour, if that, from Cleveland, but it's also pretty underserved as well. It's considered rural, and there is a big need out there, especially for primary care. So I had to do that for 3 years, and then I just kind of stayed on because again, I enjoy that work. I want to be working with like an underserved population.
This is Kate again. If you want to hear more from Adeola, you'll find the other episodes listed in the show's description. Thank you for listening to Everyday Creation, and please share as you wish.